The Everything PT podcast is sponsored by Vald Performance. Vald is the creator of the airbands for blood flow restriction therapy. If you are looking to stay up to date with today's post-surgical modalities and adding VFR to your clinic, please visit valdperformance.com.
This podcast is sponsored by CSMI, the maker of the HUMAC Norm isokinetic system. Purchase a new or refurbished machine, or you can even upgrade an existing system to bring it up to date with all the latest testing and training applications. Please visit csmisolutions.com to view all of their available products, including the HUMAC Norm isokinetic system, the HUMAC Balance portable computerized balance system, and Sportswear Online. CSMI. Better data leads to better results.
Hello, and welcome to the Everything PT podcast with Matt Taylor and Daniel Bodkin. Please do not consider anything you hear to be medical advice. Just a couple of guys ranting about everything PT. Enjoy the show.
Welcome to the Everything PT podcast. This is episode 20. My name is Daniel Bodkin. I'm joined by my guest host, Matthew Taylor. Guest host? No, my co-host, Matthew Taylor. But
Whatever.
We are joined by a very special guest tonight. And Matt, something happened in the news today.
Yeah, man.
Yeah, you heard about it, right?
I did hear about it. It was a very unfortunate accident that a young lady
in Savannah had a high velocity thrust performed for cervical manipulation and had a vertebral artery dissection. And, she's not the first person to have it happen, but it made the news. So I always feel like whenever there's a big case like that, people talk about it. And, we could discuss it because we know a little bit, but I thought it was better to bring somebody who really has a good grasp on this and that does it regularly.
Yeah, I think that would be wise. Sure.
Yeah. So we are joined by the one and only Dr. John Demutis. John, how's it going?
Good, Daniel. Thank you for having me on. I appreciate you guys very much and looking forward to talking with you guys.
So John is the second USF Bowl from athletic training, my athletic training program that I've had on. We've had Connor Lyons on already. Had you. Ali Donani talks about coming on a lot, but he always has an excuse. So you beat Ali to it. So
nice.
All right. So John and I, we were in athletic training together back at USF. And then I started working part-time for John Hisimoto. And then John, were you doing a rotation for him initially?
Initially I was, and then out of school, I also was working for him.
Yeah. I remember there was a time where we were both working. I was doing evenings and I think you were more like the full time in the clinic. So we had some crossover where we were text together.
Yeah.
So, and then I went off to PT school. You eventually went to chiropractor school.
Yes.
And that was my backup for if, all things PT failed, was I was going to go, the chiropractor route. So tell us a little bit about yourself.
Yeah, so I went to Palmer College of Chiropractic. I graduated in 2014, and I was working at a multidisciplinary practice back in Tampa with the chiropractor for the Tampa Bay Lightning, Tim Bain. Really, great office. It was called Bain Complete Wellness at the time. It's B3 Medical now, but we worked alongside a physical therapist. We had non-surgical sports medicine medical doctors there, and towards the end we had interventional pain management, which I helped to integrate into our whole kind of wellness physical medicine side of things. And after several years working with them, I moved to Boca Raton, started my own practice, chiropractic practice in Boca. And that's where I've been for the last 5.5 years. So
nice. And what's the name of the practice?
It's called Vitality Spine and Wellness.
Nice. Very nice. All right. So the big question, right? I don't personally use high velocity manipulations for the cervical spine. I will for the thoracic and lumbar. I have a very small skill set with that, but I do a lot of more mobilizations, muscle energy techniques, snags, nags, that kind of thing. So in your opinion, when would using a high velocity thrust in the cervical spine be more indicated than some of the lower, I guess like the smaller grades 1 through 3 techniques?
You know, from what I've seen, I think, you know, when someone's telling me that they've had myofascial work, they've maybe had grade, 4, 3, mobilizations and things of that nature, they're still having pain. Maybe they're still having some symptoms associated with like facet type pain that's going into the shoulder blade, etc. And they say, I've already tried this, I've already tried that. Chiropractic or spinal manipulation at grade 5, I think we tend to see good results with those facet type situations. I mean, obviously there's other situations in terms of neck pain where I would still do that, but in relation to like if you're not getting results from a physical therapy standpoint, that's something I would recommend. I mean, maybe the joint is just that fixated, or maybe the joint capsule's kind of stuck between the joints a little bit, or needs to be moved, more, effectively. That's where I would kind of think of really doing that. Most people, tend to come in to a chiropractor, essentially wanting, a grade 5 mobilization. And so obviously I do screen those patients.
Yeah.
Who it is, and some people just aren't a candidate for a manual type of adjustment like that.
All right, so you mentioned screen, right? As a PT, this is what we're told to do. Vertebral artery test, right? Not a good test, right? And then what is it, Matt? Alar ligament test? Any other ones?
Something like that. Some tests that I don't think I've ever done clinically. Yeah.
Can you talk to me more about your screening process when you're making those decisions? How do you go through it?
Well, I'm always going to check their range of motion. A lot of those tests basically are extension and rotation. So I do screen those patients, but I, looking through their history, as well, and seeing if there's any other risk factors. I don't take x-rays on every patient. But obviously if it's been a trauma, or they're having radicular symptoms or some other symptoms that would require the x-ray, and I see large osteophytes or something like that would be near, let's say, the vertebral artery, off of the facet joints, that I'm gonna screen them even more so in that regard to make sure that they're a candidate for that. Otherwise, there's other things, other methods and other techniques I would use that are not manual and grade 5 in that way.
And you do imaging right in your office?
I do, yes.
That's the one thing, man. I wish we could do that. I really wish we had the ability to image.
Well, I will say physical therapists tend to be great at diagnosing with their exam, because sometimes having an x-ray can make you lazy, or having an MRI, in that regard. So
yeah.
So it's not all be all, but yeah, I know what you mean.
I think that might be on the horizon too for PTs, kind of ordering scans, not necessarily reading them, interpreting, but probably ordering them. So, John, there is a clinical prediction rule in physical therapy for the lumbar spine, and I'll just list them off real quick. Fear and avoidance behavioral questionnaire, less than 19. Pain no more than 16 days. No symptoms extending distal to the knee. Pretty lengthy, right? At least one hypomobile lumbar spine segment, and at least one hip with greater than 35 degrees of internal rotation. The hip one always kind of confused me.
Yeah.
That's kind of weird, right? But if that patient meets that list of criteria in our physical therapy field, that's from the APTA's website, then they're supposedly a good candidate for, the HVLA in the lumbar. Is there anything like that, like in the cervical spine, or anything that similar for chiro?
I haven't personally seen like that kind of specific, rules for introducing cervical manipulation. generally speaking, I think a lot of patients, if their problem is cervical thoracic, will the goal is to do some sort of manipulation. Now, there are multiple techniques, so I think a lot of times the technique is obviously one that you're using hands, one that's manual, one that you see, on videos and things of that nature. So I tend to do a lot of different screens to determine whether or not, they are someone that I would feel comfortable doing that with. I find that a lot of times, at least more recently, chiropractors who've graduated more recently tend to be, not just adjust every single patient. I think particularly when it relates to their age and their symptoms, and if you're not sure, it's not something that you just want to go, willy-nilly on every single patient, and especially not, without an exam. So, if their symptoms are significant, if they have ridiculous symptoms past their elbow, if they have weakness, if they have, serious headache, or, something new and severe, if it's a trauma, those aren't people typically that we're just going to rush in and go and try to manipulate their cervical spine. So we're kind of, at least, me personally, I'm very, very cautious. I think less is more, especially after like an injury or a trauma, or, if they're showing significant neurological symptoms, I'm going to be very careful when it comes to that.
Looking for a way to improve sport-specific training with your athletes? Then you have to check out Blaze Pods. Blaze Pods is a neurocognitive reaction training intervention that can be incorporated into your sessions for patients throughout the treatment spectrum. Visit blazepod.com, enter code EVERYTHINGPT at checkout, and save 15% off your order today. Hey, all you rehab specialists out there, do you have an isokinetic dynamometer just sitting around your clinic not being used? Little known fact, isokinetic machines that aren't used regularly are at higher risk for bouts of sadness. Help your machine out and take CSMI's newest CEU course, Isokinetics 101 online, created by me, Daniel Bodkin, and learn how to use all the exercise and testing applications available on your machine. With new and exciting rehab techniques in your toolbox, your sad isokinetic machine can become an active member of the rehab team again and regain its happiness. Isokinetics 101 online by CSMI has been approved for 8 credit hours for athletic trainers, physical therapists, and physical therapy assistants. Contact your state board for details on specific requirements. This course is available at humacnorm.com/courses/isokinetics-101.
Right.
Well, you also mentioned that people come in because they want the pop, right?
Yeah.
I have to read this as I go. There was just last month, a study that came out, the Journal of Manipulative and Physiological Therapeutics. And it's patient concerns and beliefs related to audible popping sound and the effectiveness of manipulation. And they find that patients, and this guy right here, I believe in it as well, that if I get an audible pop and I feel that pop, I think something was done and it feels better. Even though research says you don't need the pop, like I'm the guy that wants the pop. So I get that.
I think to a certain regard, even I think chiropractors feel more accomplished if they hear and feel that sound, the cavitation. But you're correct. It doesn't necessarily mean you didn't move the joint. I had a guy, a 78-year-old patient, he'd tell me about 20, 30 years ago when he would hear all kinds of noises and how aggressive they were being towards him. And I said, listen, you're older now. You may not feel anything, you may not hear anything, but you're still gonna, the goal is still the same. We still want to move the joint. And personally, I'd rather not, hurt you, and I'd rather not be overly aggressive, with so yeah, to answer your question, what we were trained is that it's just gas being released from the joint. You stretch the joint capsule quickly, some gas is released, and that's what that is. And maybe, obviously if you move the joint enough, I think there's going to be some sound, but certain patients, especially that are older and they have, a lot of arthritic changes, you're not going to necessarily get that, and that shouldn't be your goal. And the goal is just really to restore motion to the joints and alleviate pain, and hopefully, take pressure off of the nerves that may be irritated around the joint. But yeah, your goal shouldn't necessarily be just to get the pop and the crack kind of thing.
All right, so back to the artery dissection, right? You can look at different studies and you get different stats. I've seen, 1 in 20,000 occurrences with cervical thrust manipulation. But I've also seen all the way up to like 1 in like a million, right?
Yeah.
So it all depends on what you're citing, but you would think if it's one of the 1 in 20,000 that we would see much more of this and it would be much more common of an event, right?
Yeah.
Okay. All right. I was just curious about that because I looked at it today and I saw a big variety. So my question is this: when there is an event, is it more the person it's their anatomy that causes it, or is it just the technique that was applied is more of what happened?
In this current situation, I feel like there's not enough details because just if I was just looking at her picture, it's terrible, and I feel bad. It's not someone I would think, that would have predisposing risk factors. But what my informed consent says is 1 in every million or 1 every 2 million chiropractic visits. If it was 1 in 20,000, I mean, I'm confident I'm probably 3 or 4 times past that in my career. And I've never, I don't even know anybody that's had that experience.
Mm-hmm.
And I obviously have a lot of colleagues that I know personally.
So Matt and I were actually talking about that earlier. I said, well, if I do 5 manipulations a day over, 50 weeks a year, I was like, at some point you're going to hit 20,000 of these. And it's not that common of an occurrence.
Yeah. I mean, I do think there are different techniques, some that are more higher risk. However, with that said, I think the technique, if I had to guess a person used, is one that's very common. Now, yes, I think there are anatomical variations. I think there are risk factors, that we just don't know in this situation. Because as far as young people are concerned, it is so rare, just happening in general, but particularly, in a chiropractic office. It's so rare. Obviously, someone with more experience, I think the risk is probably much lower. Aside from their actual experience, but their skill level as well. Like you said, I think there comes a lot of skill and technique with practice. Yeah. So, but it is just so rare,
Yeah, and there's a lot of opinions on it. Like me, sure. I won't do it, but I'll refer somebody if I think they need it. Matt, you have a different, viewpoint on it. So tell us a little bit about your viewpoint.
Yeah. I just think about there are some non-specific effects from the high velocity, low amplitude, thrust item that we're using here. And I just wonder if the risk is worth the reward in a lot of these situations. Are there other ways to accomplish, something along these lines? But it's something I don't do much of. I don't know a ton about. We did have a manual therapy. We were joking before, a lab for several hours, and I do lots of cervical glides, anterior posteriorly. Daniel mentioned muscle energy techniques, isometrics, but I tend to stay away from the manipulations in that area. So also I wanted to mention there's 1 out of 100,000 spontaneous vertebral artery dissections. I'm not sure how accurate that is. That's from the Canadian Journal of Neuroscience. So yeah, I know there's a lot of statistics out there, and I know our field is it's hard to get good science and good stats. So, but yeah, just curious about your thoughts, John.
Yeah. The study that I referenced is from the journal Spine. Cassidy et al. It was called The Risk of Vertebral Basilar Stroke in Chiropractic Care. And these results were based on a population-based case control and case-controlled crossover study, which is one of the best studies that I could find directly related to chiropractic care and strokes. And they were saying 80% of people experiencing a stroke have the same symptoms as someone who has a dissection. Mm-hmm. And many times people, or most of the time, they're coming into some sort of doctor's office because of the pain and symptoms that they're having. Now, as far as, the clinically, as far as what I think would help, let's say with neck pain, even though this story is so sad, it's I've seen, great results and very quick results in terms of pain, especially when people are in severe pain. Those situations where someone says, I woke up and I can't turn my neck, and like I said, I'm evaluating them. I'm making sure there's still a candidate at that moment in time. There wasn't a trauma. There wasn't something that would make me not adjust that patient. There are, a case there's it's very frequent that we would see it like a very fast relief of those symptoms and return of their range of motion. And those are someone that I would think of. I think it does make a lot of news because there is a inherent fear of cervical manipulations. I think a lot of, in this situation, I understand the neurosurgeon and the other doctor said, yeah, absolutely, it was caused by a chiropractic adjustment. I don't know enough to comment. I'm not, I wasn't there. From what I read, I can see why they would certainly say that.
Yeah.
I just don't know all the details, but it's not something that I necessarily think about every time that I deliver an adjustment. It's usually not on the top of my mind. If it is, I'm not even going to do it. It's not
absolutely
not worth it. So.
And I think, from my perspective, we had Dr. Patton, he's an athletic trainer, but he's also a chiropractor, and he'd come in and he'd work with, USF sport teams, St. Leo sport teams. And, just getting, he was very accessible to us, for the demonstrations, just that clinic time. So I think I became really comfortable because we were around it so much. I think that a lot of people, I'm really big on co-treating as well. And we need to have you back for a conversation on that one day. But I think a lot of it is just, if you expose yourself to it, you might become, it might change your thoughts one way or the other.
Yeah, I agree with that. I have several patients right now that are physical therapists, actually. But I've had multiple medical doctors in my experience who've said to me, one in particular that stuck with me, an interventional pain management specialist. He said, I really only have heard horror stories. Like, we didn't learn what you do in medical school. And, when I saw what you were doing and that you were treating my patients, my opinion basically changed, because what I thought and what I heard and what I even saw sometimes looked more scary than it actually was. So that is kind of common. Like you said, I think there's a lot of misconceptions. I think associations in some of these studies really don't mean causation. I think the study that I referenced, the Cassidy one from the Spine Journal, their findings were that you're no more likely to have a stroke or cervical dissection walking into our office versus your primary care's office. And from an insurance standpoint, our malpractice is on average about $4,000 a year, which is, a primary care physician's are going to be 4 to 7 times more than that.
Yeah.
And so I'm not necessarily shifting blame or trying to change the subject, but the risk is just so low that, obviously the insurance would reflect that if it was that, prevalent.
Absolutely. Well, John, we got to get going. Matt has what is it? You're on the World Series tonight?
Yeah, I got the World Series of Church softball in Charleston, West Virginia. And, I'm so dropping some dingers.
Real quick. Again, I plan to have you on here for other topics in the future, but real quick, where can people find you? How can they get a hold of you?
So my office is Vitality Spine and Wellness in Boca Raton. The number is 561-419-6915. The website is vitspine.com. vitalityspa.com.
And you got a social media presence?
A little bit. Yeah. Just you can type in Vitality Spine and Wellness on Instagram or Facebook. But working on that social media a little bit.
Yeah, always.
Yeah, it's rough. Never ending.
Well, hey, John, thanks for coming on. We appreciate your time, and thank you for kind of clearing up a lot of that. That way we weren't just kind of fumbling our way through some of it. So great insight. I appreciate it.
Thank you guys so much. I really appreciate it.
Thanks, John. We'll see everyone next time.
All right.